when you do a ketogenic diet, I mean, there's a lot of people who come to me for psychological issues. We do a ketogenic diet and they're like, I'm good. It's been great, Nicole, but I don't need you now. And they go off and they leave. And that's great. And I'm like, be careful, you might, because I have had one of the things about them saying that this diet is unsustainable is that sometimes people will have benefit and then they will accidentally fall off, or they just won't understand the implications of having a treat, and they can go into mania, for example, or they can get a relapse of their symptoms. And it can be nice to have someone in the wings to help them get back on track, help them deal with any shame from anything that happened of that. So I always say, don't be a stranger, but and then social situations too. Like, as you do this long term, what does this mean for relationships that you have completely transformed? And you're part of a system, and how is your system handling that, and what's happening? Not all systems handle change. Not all systems are okay with that. There's things that go on. So yes, I'm glad they feel better, and I hope they reach out if they need any help with that sort of thing or want to further optimize with lifestyle change. You're probably the same way with your practice, what you do. But it's just easier. For the ones that stay, that are like, now I feel ready, better able to approach trauma. I feel better able to do EMDR and kind of desensitize some of those things that still trigger me, because I really like feeling good and I really want to feel good. And so I just find that the effect size of the change I see is much better on a ketogenic diet. When I cognitively, without the ketogenic diet, sometimes I will work in session to help someone cognitively restructure a negative thought that is causing them distress. And at the end of the session, they're like, oh yeah, I feel a lot better. That's good. I believe that new thought. I have a different emotion with that, but they come back with the same thought that we just restructured. It's almost like there's a stickiness, like a rigidity, and it makes sense because your neurochemical environment helps prime you for what memories and thoughts you're going to have.